just recently, I had a patient who was interested in egg freezing, did the testing, turns out she has PCOS. Now we're having a whole different conversation, right? So it's not so much, oh, I need to go freeze my eggs tomorrow. It's really about, number one, understanding your body. Number two, what's normal, what's not normal. And number three, education is empowerment.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I am super excited to have a very special guest here today, Dr. Carolina Sueldo. I'm just going to have you tell us a little bit about yourself and your journey to medicine.
Sure. Yeah. So first of all, Erkeda, thank you so much for having me here today. Teaching and medical education is actually a passion of mine. So I'm really excited for today's talk. I am originally from the Central Valley of California. So for anyone who knows California, we're smack dab in the middle, halfway between San Francisco and LA, a little town called Fresno. Well, not so little anymore. It's the fifth largest city in the state. So I was raised here until about the age of 15. And my parents are both from Argentina. They immigrated in the early 70s, and they always wanted us to experience their culture. So when I was 15, we moved down to Buenos Aires, and I actually finished high school. I finished high school there, and then ended up staying for medical school. So I did it's on the European system. So I did a 6-year program down in Buenos Aires. I finished medical school at the age of 23. I started my OBGYN residency back here in California at 24. I was here for 4 years. During that time, I matched to an REI fellowship in Connecticut. They were my first choice. Go Huskies. They're actually in the Final Four of March Madness. And so after my fellowship, I took a position with a big practice in South Florida. I lived in Miami for 3 years. And then in September of 2018, I moved back to my hometown of Fresno, California. And I've been practicing here for about 5 years.
That's an awesome journey. And there are so many questions like I have now, like hearing from where you trained and then the different systems and everything like that. So if we don't hit on all of that today, we'll probably have you come back. For those who are listening, no, she did mention March Madness. We are taping this in March, but this will probably come out a little later. But by the time you guys hear, we'll know who actually won.
There you go.
So in that same vein, so you decided to go into OBGYN, and then you decided to specialize in REI. Why was reproductive endocrinology such a passion of yours, and why do you think it's important for us to know about?
Yeah. So I was one of those. So basically my journey into medicine was my parents telling me, I knew I liked to help people, and I knew I didn't want a desk job. Those were my two criteria. And then my parents were like, okay, well, within that, go ahead and go for the highest degree. And I was very fortunate, actually, that going into medicine in Argentina, my first year, I had anatomy, and they were two brothers and their father that taught the course. And they were so passionate about human anatomy, and just the way that they spoke about it and the way they conveyed it, it really made me fall in love with medicine. Because, as a medical student, sometimes being in those first years of just basic sciences can be tough. So being around professors that were so passionate about it was really helpful. And then once I got to clinicals, I loved everything. And so I wasn't really sure what to do, but I really was passionate about women's health, female empowerment, reproductive rights. That was always just from early on, without having much knowledge, it was something I was very passionate about. And so my father, for those who don't know, both my parents are physicians. My mom was a psychiatrist. My dad is actually a fertility doctor. And I was very much of I'm going to carve my own path, and I'm going to pave my own way. I'm not going to be the daughter of. So when I finally reached the decision of being an OBGYN, I said, okay, I'm going to do OB-GYN, but I'm definitely not doing REI. And I truly went into it because I realized the lack of education even among the most educated women. And I was like, well, if this is their baseline knowledge, I can't even imagine for the average layperson, right? So that really was what sparked my desire for women's health. And then once I got into residency, I was fortunate enough to be exposed to the IVF laboratory. And what they do in the IVF lab is just so special. I mean, to this day, it's something that just continues to wow me, that we are able to literally create life. It's so beautiful. It's very moving. It's extremely impactful, and you really are literally changing somebody's life. So I would say that I fell in love with it for the science. I loved that it was a young field. I loved that there was still, studies coming out that were changing practice. It's continually evolving. We're continually trying to improve our pregnancy rates. In the short span of 40 years, we went from like a dismal 15, 20% pregnancy rate to now in some places we're quoting 55 to 65% pregnancy rate. So, in just such a short time, there's been so many advances. So that was really, really exciting to me as a resident. And then once I actually got out in practice, I really genuinely fell in love with it because of the relationship with the patients. This is such a unique relationship in any field of medicine, even within women's health, because you are coming to a couple at their most vulnerable. This is an extremely painful, personal, intimate journey, right? And you're the one who's sort of guiding and recommending and helping them along the way. And when you help them, and guide them through that, and they're able to conceive, that is a relationship that, I still have patients. I've been in practice now almost a decade, and I still have patients from those first year or two that are still sending me updates about their kids. I get Christmas cards. I still get notifications. I've become friends with several of them. It really is just such a unique bond that is very, very particular to this field of medicine. So I am really, really fortunate. I don't think it was like I woke up at 2 years old and wanted to be an REI. I kind of sort of stumbled a little bit along that way and kind of went for the next step each way. But I consider myself really, 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 really lucky to be doing what I do every day.
And I feel like those are the best ways that people find their passions. For the students who are listening, a lot of times you may come into medical school and you may be thinking, oh, I know I'm going to be an OBGYN, or I know I'm going to be an orthopedic surgeon, or my dad is REI. I'm not doing that. Absolutely not, even if I like it. Right. And the good thing about going into medicine, or my advice, is to go into it with no expectations at all and treat each rotation as if it's something that you could see doing for 30 years or whatever that may be, but go into it and put your all in that 4 to 8 week rotation so that you can take a step back and assess if it's for you without necessarily waiting to the end of the year where it's time to submit time for sub-Is and things like that, where you may not have your OBGYN rotation until the end of the year and you're dead set on doing that. And then you get to it and you're like, look cooler on TV. So there are definitely people who get there and they've had their whole life plan around it. And then they get to that specific rotation and they're like, okay, what else is there? So going into things with an open mind is definitely something that's recommended.
And I would also add to that, I love that, by the way, and I wholly subscribe to that as well. I think one additional thought to that is also, if you really love something, don't be dissuaded from it. So, as a woman in medicine going into OBGYN, is like, oh, you're never going to have a life. You're going to be on call. What happens when you have kids? The work-life balance doesn't exist, et cetera, et cetera. So it was extremely not disheartening, but it was like, man, am I really making the right decision? Should I maybe reconsider? Do I really want to do this? And I think I doubted myself more because of those external voices, where if I had just gone with my gut, it would have been a much more decisive decision, pun intended. And so I think it's, yes, the surgical specialties tend to be a little bit more demanding than non-surgical specialties. But especially in today's medicine, especially with the generations like myself that are coming through and understanding the importance of work-life balance, no matter what specialty you choose, ultimately, once you're past training, you can carve it out to what you want it to be.
Absolutely. And that's the one thing where you get this training, you obtain it, but we're living in an age where everything is changing and everything is moldable. Like you can, like me, I'm a family physician. Some of my friends who trained with me are working in a traditional clinic. Some of them are working in healthcare tech. Some of them are working with utilization management, all of these different things. Like you can come and you can bring your skill set and do something with it, or even subspecialize in terms of some people who may not want to do full spectrum family medicine may do work only with adolescents or work in the school system and things like that. So going in and putting your best foot forward and not letting, like you said, anyone tell you no, like letting you define who you are and where you want to go is very important.
So I think, and one of the reasons I'm on this podcast and one of the reasons that I'm on social media and one of the reasons, well, probably the biggest reason that I'm out there is fertility education. And I think that there is, again, even amongst the medical community, even amongst attending physicians, a very limited understanding about the biological clock. And what does that actually mean? And so what's really important to understand is that women are born with all the eggs they're going to have, and they lose those eggs as they get older. So really, when you look at the studies, our peak fertility is somewhere in our late teens, early 20s. And then there begins to be this slow and progressive decline. Now, we know that outcomes in terms of the chance of getting pregnant, the risk of miscarriage, the risk of genetic problems, all of that remains fairly stable until about age 35. So when we talk about egg quantity and egg quality, really kind of that 30, and remember, nothing magical happens on your 35th birthday, right? Like this is all a continuum, but we know that things remain fairly stable until about age 35. And then we know that there's a very real decline in both the number and the quality of the eggs that a woman has. So becoming pregnant can be more difficult. Certainly above age 40, that decline is much more dramatic. The reason that it's important for, medical students, even pre-med students, to understand about this ovarian aging process is because we want patients, especially women, to feel empowered. So, when you're doing this testing, when you're understanding, number one, I always start with what's normal and what's not normal. So number one, are my cycles regular? Do I get regular monthly periods? Yes or no? Are my cycles painful? Do I have painful periods? What about painful intercourse? And really having an understanding of your body, I think, is so important, because what you don't want, which is what I see in my office every day, is, doc, I wish someone would have told me. Doc, I wish I would have known 5 years ago and I would have taken action. Doc, how come, XYZ wasn't diagnosed 10 years ago when I was presenting with pain doubled over on the floor of my bathroom or whatever, right? So I think it's so important to come at it from an informed standpoint. When you have, and things might come up, right? So, as a fertility doctor, sometimes the pushback is, well, you just want everyone to freeze their eggs. And really nothing could be further from the truth. Yes, I am very passionate about fertility preservation. Yes, I definitely think there is a role in our society for patients to consider fertility preservation. Do I think everyone needs to freeze their eggs? No. But in the information gathering stage, there can be things that come up, right? So if you get your ovarian reserve, which is the number of eggs that you have remaining, if you get your egg reserve tested and that comes back low, that may change where you're at. That may change, oh, you know what? I wasn't really thinking about it, but maybe now I do need to think about it. Or, just recently I had a patient who was interested in egg freezing, did the testing, turns out she has PCOS. Now we're having a whole different conversation, right? So it's not so much, oh, I need to go freeze my eggs tomorrow. It's really about, number one, understanding your body. Number two, what's normal, what's not normal. And number three, education is empowerment. In medicine, we talk a lot about informed consent. And I think the more knowledge you have, the better decision-making you can make, right? So let's say, I don't know, I'll just make up a scenario, but I'll use my scenario. I was, I finished medical school younger than most because I graduated abroad. I was an IMG. So I finished residency at 28, fellowship at 31. I was a new attending in a new city. I was single. I didn't have a partner. And I was like, well, if I preach this every day to my patients, like, what is my plan? What is my family building journey going to look like? Right. And so here I am, 31. I know that until 35, egg quality is still sort of relatively optimal. And so it took me almost a whole year to really pull the trigger. But ultimately, I did go through with it. And it's the best. I have not once regretted it, not one day in my life. I have never, ever had somebody say, I wish I didn't do it. I have only had people tell me, I wish I would have done it sooner.
I couldn't agree more. And I think what is interesting to me, and one of the reasons that I arranged for you to come on the show, it's something, like you said, that's not talked about. It's pushed under the rug. Like, people don't like to talk about their fertility journeys. But when you're in that situation, people all come out of the woodworks like, oh yeah, this happened to me too, and that and stuff. So I think that it's so important. Full disclosure for those listening, this is a personal share for me too. I also froze my eggs because I feel as though, and it's different for everyone and everyone's situation, but a lot of times people in medicine give a lot of their time to their career and studying and thinking about what's next and fellowships and all of these things. And then when you get to a certain age, you may not be in the position where you're ready to start a family, or you've taken that partner and things like that in just the medical world. So it's very important to start thinking about these things, especially when you're at a younger age, because like you said, the body, they don't read the calendar and they're like, oh my goodness, I'm 35. But studies have shown that egg quality is better, and there is like higher likelihood of having a successful pregnancy the earlier you do it, depending on what your numbers and things are.
And I think one other thing that's important that is also not talked about is the cost associated with doing this, right? So most states in the US, including California for that matter, do not have a mandate. Well, that's not true. They do have a mandate, but insurance payers are not required to cover fertility preservation or infertility treatment. So most patients are out of pocket for all of these expenses. It was a huge, huge achievement that our house staff here, residents and fellows at UCSF Fresno, were recently awarded or granted, or whatever you want to call it, an additional benefit for fertility that wasn't there before. And I think there's so much work still to be done at the legislative level when it comes to fertility benefits. But if you know that this is on the horizon, then from a budget standpoint or from a family planning, you know, the same way you plan for med school, your loans, the same way you plan for, okay, if I'm a resident, I'm going to be earning this much, I can do loan repayment or whatnot. This is something you can also be budgeting for, right? So that it's not like, oh, all of a sudden you have to come up with these thousands of dollars out of the blue. So that's why I think having that education is so important, because then you can also plan accordingly.
You're absolutely right. And one thing that I will add, there are perks and benefits to being a resident. I know some of you may have listened to some of my episodes about disability insurance or life insurance and things like that. And you're the healthiest you're going to be at the age you are right now. So there are some benefits. Like you said, sometimes you can choose your job, like when you're becoming an attending, as according to what benefits they have, because some of them do have fertility benefits at certain jobs. There are also some programs from different fertility clinics that have specials for, number one, attending physicians, but they also have some for residents. I recently saw one where they're, and you guys can look this up, don't quote me, I think it's Shady Grove, I'm throwing out their name, but they have a special where they can do a package for surgical residents to preserve them for their eggs at a cheaper fee. Now, like you said, we have some work to do to expand it to other organizations that are including fertility benefits, as well as programs like this. Like, why isolate the surgical residents? Like, everyone has, like, there are women in every field. So we have some work to do, but there is some place to start. And it's better to start planning, like you said, just like we plan for how we're going to repay our loans or different things. If things were to happen, it's okay to plan your life and your fertility journey as well. For the people who may be considering this and they want to know what the process is like, especially if they are in training. And, during residency in med school, your time is not necessarily your own. What is the process and the timeline like and things like that?
Sure. Yeah. So I like to break it up into 3 stages. So the first one is going to be the testing stage, and that's just trying to identify what is your ovarian reserve and then completing the checklist. So for example, most clinics require an infectious disease screen, urine gonorrhea and chlamydia, an up-to-date pap smear, things like that. So you would basically just kind of be checking those boxes. The big one though is the ovarian reserve. And that's where some interesting findings might come up. So in the testing phase alone, you may end up kind of shifting gears and sort of changing the conversation. Well, I came in with a plan to do egg freezing, but we found this, so now this, right? Mm-hmm. Assuming that everything looks okay and we're now going to be moving on to the preparation stage, there's really sort of this IVF checklist that most clinics will have. Just making sure that you've kind of checked all the boxes. They're going to help you order medications. IVF medications, at least today, are not found in local pharmacies. They are found in specialty fertility pharmacies that have to be shipped to your home. And so your clinic would be helping you with that. And then there's typically some paperwork, consent to treatment, consent to the procedure, and then, what happens to the eggs if you decide ultimately not to use them or you complete your family or whatnot. And so that's all happening sort of in the preparation to to stimulation. And then the treatment stage would be that 2-week egg freezing process. So during those 2 weeks, you're basically undergoing transvaginal ultrasounds and typically blood draws. And we're trying to monitor your response to the medication. Are we dosing you appropriately? Are we having a low response, a high response? Do we need to adjust medications? So that is all occurring during that 2-week time frame. And I always joke with patients that typically during those 2 weeks, we are your best friend. You are generally coming in, multiple appointments pretty much every other day, assessing response. And depending on the clinic, they may or may not be more or less flexible with those appointment date and times. And so you really want to be sure that you're communicating. If you're a resident, this may mean waiting till you're on an elective or waiting until you have vacation or whatnot. So there is some planning that will have to go into that. But really during those 2 weeks, you're having those monitoring appointments during the time you're doing the stimulation. And then the last visit will be that egg retrieval procedure. The egg retrieval procedure is a surgical intervention. We do it transvaginally. It's done typically under some form of anesthesia or sedation. And we are putting a needle into the pelvis. So we do consider it a surgical intervention. We do talk about the same risks, benefits, and alternatives we would do with any surgical consent. And then the needle is typically connected to suction tubing. And so remember, we don't see eggs on the ultrasound. What we're seeing is follicles or fluid sacs that house the eggs. And so we're aspirating all of those follicles from one ovary, and then we go to the other side and we do the same thing. So the day of your egg retrieval procedure, you typically will leave knowing the total number of eggs retrieved. And then later that day, the embryologist will identify the quote unquote mature eggs. Those are the ones that have typically finalized their maturation process and released their first polar body or half of their DNA. The med students are probably more familiar with that than even me. And so then typically you'll get a call the next day, hey, of the, 20 eggs that you got, 15 were good. So those were the ones that we froze. And so it's generally speaking, the treatment itself is a 2-week process. It's just the lead up to it that takes a little bit of time because you want to organize and make sure everything is sort of teed up and ready to go before you start.
Absolutely. And I think that was such a great overview of the process. So you've shared so many pearls of wisdom with us today. I'm going to leave you with this question that I love to ask all of my guests and it'll be very interesting to see what you say since you've trained in 2 systems. So the U.S. healthcare system has definitely some room for improvement, some areas for growth. We're not perfect. So if you had a magic wand and you can change any one thing about healthcare, what would you do?
Oh, wow. Just one, huh? So I will say, because this is my area of passion, if I could change one thing, it would be fertility benefits, because right now, many states in the U.S. treat infertility or fertility preservation as an elective procedure. And if you're going through infertility, those patients will tell you nobody is choosing to do that. Nobody wants to be seeing me, right? As nice as I am and as helpful as I am, nobody actually wants to be seeing a fertility specialist. So if I could change one thing, it would be modifying the fertility benefits in this country.
I can agree with that, although I'm sure we can create a list of many more.
Yes.
So, thank you so much for joining us. I'm sure everyone who's listening learned a lot. I just want to give you an opportunity to say goodbye and let the listeners know how they can reach out to you via social media and things like that.
Sure. Yeah. So as I mentioned, my name is Dr. Carolina Sueldo. And so I made it really easy. I have a YouTube channel with that name. I have a Facebook page with that name, and I have an Instagram with that name. I'm probably most active on Instagram. So if you listen to this episode, you found something useful from it, I would love to hear from you. Shoot me a DM. If you're wanting more education about fertility preservation, about the biological clock and ovarian aging, my YouTube channel would be the best place to go.
Thank you so much. And for all of the listeners out there, we'll definitely put the Instagram in the show notes. So if you have any questions, definitely reach out. And I'll be back next week with another amazing guest. And I want you guys to just reach out to us and let us know if there's anything you want us to cover in terms of topics or guests. See you next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.